Thank you so much. It's one of those quotes that always you're wondering if it'll ever come back to haunt you, and it looks like I've just found an example when it does. But let me share, at least for the next 10 minutes, certainly why that is my innate belief. I'm also very conscious that I'm standing in the way between you and caffeine, so I'll certainly try and keep you engaged as well. Given the day that's in it, and what's hitting the tapes, hitting the news wires as the top story in India, actually, and around the world, I want to borrow a quote from a great man when we're thinking about just the size of some of these challenges around universal healthcare and collaboration that we just heard from Professor Taylor and Lord Kakar. The quote of, progress is a journey, and you'll get stones thrown at you, and it's up to us to turn those stones into milestones, as said by the maestro himself, Sachin Tendulkar. So let that be our fuel to nurture us. I really want to focus on three things. The question that was put to us, and thank you, Rakesh, for inviting me along, was around this growing and emergent field of impact investing and whether that can play a role in really trying to bridge some of the challenges that we've seen where markets haven't worked, government isn't working, charities, NGOs not working, and really frame it in three ways. The first is to explain or demystify the sense of impact investing. The second is to explain Acumen, where I work, and give a couple of examples of where we see there is real exciting potential. And the third is to answer the question with a no, impact investing isn't going to do it, or perhaps more accurately, no but. Or actually, I'm a trained economist, so it should be, it depends. And really say where I think collaboration can actually provide us a huge amount of hope and opportunity for actually addressing some of these huge challenges. It was very interesting to hear Ashish earlier, CEO of Bombay Stock Exchange, talk about long-term value by companies. It's great, it's admirable, and there are some clear exceptions. We, of course, know Tata very well. But it sure isn't the norm of what I've seen out there when it comes to the private sector. And this is standing here in front of you as a former investment banker, where, frankly, we see complete short-termism and focus on maximizing the financial returns with not much or maybe some token thought to social return. And therefore, seeing where the risk return doesn't work, the market's often bypassing the poor. And meanwhile, if you want to sort of get sanctimonious, you can say, well, what about charity? Shouldn't that be what we therefore look at? But I think we can all agree the reality of traditional philanthropy and aid has created a huge sense of dependence and charity. And so impact investing was founded a couple of, about 15 years ago, 12, 15 years ago, really with the sense of, can you try and combine elements of both? Can you try and bring some of the aspects of the markets, use the markets as a listening device, see what the poor actually value, are prepared to pay for, provide them with the affordable choice, and not treat them as passive recipients of handouts? And is there a way to try and reconcile the two? And as Margaret Mead wrote, there's nothing as exciting as an idea whose time has come, and it appears to many that impact investing, maybe its time has indeed come. From early days when Jacqueline Novogratz founded Acumen in 2001, we've seen over 300 funds now explode onto the world scene, which is, on the whole, extremely exciting, but also quite challenging because we struggle still to have some clear definitions of even what impact investing even means. A little bit above, you want to get your capital back. Well, how much do you want to get back? And are you really trying to chase a financial return? And is there a trade-off to the social impact? And if you recall C.K. Prahalad's book of Fortune at the Base of the Pyramid, is it at the very base of the pyramid? Because sometimes people can't afford to pay anything. Or is it maybe somebody who's earning 10,000 rupees a month and maybe they can? And what about that huge swathe of hundreds of million people in between? What about urban? What about rural? What about tribal? And I think whilst we're in the stage of growing pains, the opportunity is to try and understand some of these questions. And look, if I can see far, it's because I stand on the shoulders of giants, really see where some of the successes, and indeed, if I can utter the F word, failure, see where some of the failures have been, and really learn from them as well. So Acumen was founded in 2001 by Jacqueline Novogratz. Coming from a previous commercial world, this sort of seems like a pretty small number. $85 million in 12 years actually rather underwhelmed me at first, in truth. I've been with Acumen for two and a half years now, and clearly that number was lower. But I can tell you, an $85 million business in the city isn't reaching the lives of 100 million poor people. Or if it is, you don't want to think how it is. And so what is this sense of how do you actually go about doing this? How can you provide capital and technical support to companies that are providing critical goods and services for the poor in a way that actually inculcates dignity into the core of what you do? So Acumen made its first investment in India in 2001. Our office was set up in 2006 in Hyderabad, now in India. I was going to focus solely on our health portfolio, which is our largest, almost 50% of our portfolio. But actually what struck me as I was preparing, I thought, well, wait a minute. If I look at some of our clean drinking water companies, think of these waterborne diseases that cause so many problems, particularly amongst young children. If I look at some of the sanitation concerns that happen, spill over into health. If I look at access to energy and the consequences of inhaling kerosene rather than having access to solar and renewable clean energy. If I look at nutrition challenges and opportunities in agriculture, in many ways, this interdependency is huge. Arguably, all of this relates to health. But I guess in terms of how we classify it, we look at traditional healthcare companies and how they activate. And I'm just going to touch on 3 examples to try and bring this a little bit more to life. I also wanted to mention here, and it was Lord Keikar touched on it as well, this point on human capital and the incredible need. And to deliver this, it's just not about the finances. And we're very fortunate to have a country director who previously worked at Piramal Healthcare. I think we heard it mentioned a couple of times earlier. And a couple of our global board members, actually, where we have representation from the countries we work, India, Pakistan, Sub-Saharan Africa, Latin America, and so on. Our G.V. Prasad, many of you may actually know from Dr. Reddy's. And our first ever investment in India in 2001 was an organization called Aravind Eye Hospital. Lord Keikar will know it well. And the executive director, Dr. Venkateswamy's son-in-law, Tulsi Ravilla, sits on our board as well. So really the sense of actually what this collaboration that I'm going to be building to, the different types of capital that is required, thinking far beyond, in a linear fashion of healthcare companies and the financing required, but actually realizing the capabilities that are really needed. So 3 quick examples, if I may. The first was an ambulance company that we invested in 2007. We've made just over $2.5 million investment. We invested when they had 7 ambulances. It was kind of a crazy idea where 90% of patients who got put into an ambulance in Mumbai were actually sent to the morgue. And actually, where we had 2 young social entrepreneurs who realized one was studying in Harvard, one was studying in India in one of the IIMs. And their mums actually, as these stories go, fell ill at the same time and had very, very contrasting experiences and said, well, wait a minute. They sort of thought, what can we do? Maybe we'll set up a nonprofit. Maybe we'll raise some money. We'll run the marathons and do that kind of stuff. And then they realized, well, wait a minute. There's a real need here. Is there an opportunity for us to actually find if we can build a business that looks to become sustainable, ultimately turn a profit, but actually have a sliding scale model depending on where you're dropped can determine how much you pay. If you get dropped at the Mukesh Ambani hospital, you pay a certain amount. And if you get dropped at a government hospital, you pay far less and have free transportation from road traffic accidents. And this idea of cross-subsidy was rather revolutionary. And a lot of people thought it would never work. And conventional commercial capital, if again we retain just that single lens, will say, look, there's a huge risk there, not obvious financial returns, albeit with high potential social impact. And that's where Acumen actually came in, where we made this investment to try and understand how we could provide the financing and the governance and the post-investment management support. Now they have over 1,000 ambulances, second biggest ambulance company in Asia. And actually we're seeing that they're getting contracts from 5 different states in India. And what's been really striking as well, and I was struck how little, Mihir was obviously very entertaining. I don't know if he's still in the room, when he talked, had a throwaway comment on corruption. But it's a big deal. And these are private companies. And the amount of business that this company has visibly and laudably turned away when it's come to taking these state contracts has been huge. It's something I think we need to talk about. I don't think we need to overstate it or annoyingly talk about it all the time, but I think we need to acknowledge it for what it is. And actually, where they've grown has been keeping this sort of very whiter than white approach that they've had. A company in Hyderabad was a joint venture between us and Hindustan Latex, really to see if we could provide maternal health services in a very dignified, clean, and high-quality environment to those who, didn't want to have, births at home or in these horrific government hospitals and clearly couldn't afford the private hospitals. And what we've seen, again, is this fascinating story where not only have we found that 19,000 births have happened in these hospitals from when we invested now up to 12 hospitals, and a potential huge trajectory across Andhra Pradesh and beyond. But we're actually seeing now clear examples being used, again, actually interesting on a corruption basis, where there's visibility as you walk in on the costs of these services so that you don't get trapped and tricked at the critical times in the healthcare delivery for bribes, which has so often been the stories that we've heard. And building on the Arvind Eye Care example, I don't know if you guys have read this book, Infinite Vision. It's one of the most thrilling books that I've read in the last couple of years. Has spawned off many other eye care models, similarly this sliding scale opportunity, and PVRI that we've invested in has now given 270,000 eye care treatments, 90% of people of whom are below the poverty line as well. And so really to come together on where I believe this is going, it's a collaborative approach that's going to get there. I think if we expect a silver bullet, I'm afraid impact investing, in my view, isn't going to provide it, just as microfinance didn't provide it, as some thought and maybe spoke about 5-10 years ago. But actually where there is real potential of actually having this demonstration effect. I mentioned the core business model of LifeSpring, this amazing social enterprise that's providing dignified C-sections, hysterectomies, and normal deliveries, and starting, being a self-sustaining model. But realizing that unto itself, that's an interesting case study. That's a thrilling case study, arguably. But that's not really going to move the needle. What's really going to move the needle is if we're going to start actually understanding around education, if we're going to start understanding the role of interdependence, if we actually understand the role of the mother-in-law plays when the child is born, if we understand what the health outcomes that we're trying to solve for are, and understand the different types of funding that are required to achieve that. And so ultimately, my view in answering this question that Rakesh posed to me on the how, is on the how. How do we actually start aligning people to do that? Because I think it's around developing these specialized roles when it comes to social impact, understanding that the government isn't going to achieve it, aid isn't going to achieve it, social enterprise isn't going to achieve it, media, NGOs, and conventional private sector companies are not going to achieve it. And so how do we start aligning and stratifying where different people can play a role? And I think the interesting aspect may be around social enterprises and impact investing from a delivery perspective, but integrating very closely, where we see, for example, the previous panel talked about the Planning Commission and some really great policies that are in place at a federal, at a Delhi and at a state level. But actually, when you go and you see the primary health centers and the secondary and the community health centers, and you go to the tribal areas, the policies may be in place, maybe some of the centers may even exist, but the delivery is non-existent. And is there a role for social enterprises to start collaborating and working there? And we see that in each of our investee companies. And for us, as my big passion, as you can probably tell, is around healthcare. Being married to a medic is probably no bad thing for that as well. But actually learning from other sectors as well is key. Energy in India is making huge strides. The Ministry for New and Renewable Energy is providing huge capex subsidies, indeed even to some of our biomass and solar companies. And are there other sectors even within India and collaborations between the UK, the EU, the US, and India that we're seeing in a non-healthcare perspective that can also help us to understand this? Because I think that is ultimately the how social enterprise can play a key and contributing role towards achieving these health outcomes that I think all of us are looking for. Thank you very much indeed.